Greetings to friends of Israel around the world. My name is Wayne Firestone. I'm the Executive Director of the America-Israel Friendship League, and I think it would not be an understatement to say this was a week when having friends became all the more important. This has been a challenging week for all of us, but especially for our friends, colleagues, and family in Israel, and the immense pressure and stress that you can imagine putting upon an individual, a community, or a nation once again finds itself clouding the skies of Tel Aviv. We're told by one of our panelists that it's actually the weather is beautiful outside. And in spite of that, Israeli society goes on to do the things that it does so well day in and day out. Today, we are among friends, and but in addition, we're joined by colleagues who have a special expertise that emanates from Israel, dealing with trauma and the creation of resilient communities as a result, as a response to that trauma. And frankly, I wish this was something that Israel did not have great expertise in. And maybe that could be a collective goal, or for those who pray a prayer, that one day that would not have to be one of the things that Israel has to be great at. But it is great at it. And we've learned, as you can imagine, had intended this program today to talk about the world-renowned expertise that is embodied in the organization NATAL, the Israel Trauma and Resiliency Center that Israelis rely upon, but increasingly communities around the world rely on for their expertise. Our plans were somewhat changed, and we will now dip into some of that talent and reservoir of experience for ourselves. And indeed, for those gathered today and those that will watch the webinar, you'll have an opportunity to ask questions, to share your own pain. And, you know, I'd actually like to start the webinar first by just asking people if they'd like to put a few words about how you are feeling at the moment into the chat, or to say it to yourself as well. This is a period where we recognize that just sort of acting like everything is normal is also not normal. This is not normal that people have to live like this. And we are grateful for the opportunity, even during this period of COVID, where we're still, many of us, just beginning to come out of our bubbles, just beginning to figure out our own comfort zones, just beginning to actually breathe and celebrate life in the world that we were used to. Israelis find themselves back in shelters, in stress, in trauma, not celebrating, and hugging people in different ways and in different times of night and in circumstances that you all are aware of. So we thank everyone for joining today, and our colleagues who you're going to meet. I just want to briefly introduce them so we can let them share from their perspective what they've learned and how hopefully they can help and provide us support during this difficult period of time. I'm so pleased to introduce Jude Yovel Rekanati, who's actually the founder and the chair of NATAL. She will give us a little bit about the history and what it's like going through this period of time. We'll be joined by the head of international programming, Ophir Peleg, and his colleague, Kim Pitler-O'Mara, who does program management at the NATAL's Global Resilience Center, and a board member who's in the United States but wishes she could be in Israel and is planning to come to Israel, Tony Young. And this conversation would not be a conversation about the NATAL of today if we didn't have a true friend of Israel, Pastor Chris Harris, who I first met over the summer during the very height of social protests and real crisis in American cities. Pastor Harris joined us from Chicago on one of our earlier webinars and brought such sense and sensibility to what is required for people of good faith and people of faith to come together in times of crisis when you're dealing particularly with violence and the trauma of violence. And I'm so grateful to have Chris Harris here today to share his perspective on how NATAL has been a resource for his community in trying times and in even more trying times as we've all experienced during COVID. So Jude, if I could ask you to sort of start the panel and some brief introductions, and we have some incredible materials your organization has prepared to share with our audience today.
Of course. So good evening. In Israel, it's evening now, so good morning to you. I will tell you about the history, my own history, who brought me 23 years ago to start this organization. And I will do it briefly, as I know we don't have too much time. But what I can tell you is that I grew up in Tel Aviv, in Israel. I was born to a Sephardic Jewish family whose origin are in Italy, but they lived in the 19th century in Greece, in Salonika, which was a very Jewish city. And my grandfather was one of the leaders of this community. And in 1934, he saw the anti-Semitism in Europe. And he was very clever, and he suggested his community to leave Salonika and come to Israel. So about 20,000 followers followed him, and they came to Israel, and they were saved, as we all know. So this, my grandfather, his name is Leon Rekanati, and as I said, he was a leader, and he was a very clever man. And he started in Israel an Israeli bank whose name is Israel Discount Bank. And this bank was known as a bank that is not only doing business, but also taking care of community of Jews that came from Europe in this time. And he was like a pioneer in seeing the bank as also a social opportunity to help others. He had 4 sons. One of them is my father, Daniel Rekanati, and he and his 3 brothers, unfortunately, very early in age, in their 20s, they became the owner and the manager of this bank because my grandfather passed away in 1945 because of an event, a brain event, and they became the owner and the one who led the bank for many years. So as a child, I grew up in a philanthropic family. And I got many messages that were not told verbally. I understood that I am lucky to be born in a family that is wealthy, that is well-to-do, and that we have obligations and a lot of responsibility to the city, to the country where we live. And since I was really very young, this was very clear to me. Nobody told it to me. Nobody educated me in a way, but I got the messages that were untold. And I grew up, and in these years of after World War II, in schools in Israel, we were taught about the Holocaust. We understood and we knew what was the destiny of the Jewish people in Europe. And besides this, we learned about the Independence War and the fact that we are the first generation after World War II. And we were very, I can say, very happy children, but we were also with the burden of the past. This is something we could not at all forget for a minute. We had a lot of events of memorial days for soldiers, Memorial Day for the Holocaust. And as a small child, I was in my 5, 6, 7 years old, I really was very much affected by these events. And I was reading a lot of books about the Holocaust. And I grew up with a kind of identification with my people. I understood and I had a very strong feeling for people who suffered. And I really felt a lot that one day I will do something important for my country, for my people. I went to the Scouts. I was a leader in the Scouts. In Israel, the Scouts are boys and girls together. And I felt very much involved in the society of those times. And I will just go through the years that went by. I went to the army as all my age group. When we are 18, we go to the army. I was an officer in the army. And then I decided to learn and to become a professional psychotherapist. And I went to learn in Boston, in Lesley College, and I became an art psychotherapist, which gave me the opportunity to help people that suffered from trauma. And this gave me a lot of satisfaction. During the years, I went on with my studies and went to study also psychotherapy in Bar-Ilan University. And after that, I started working in rehabilitation center in hospitals in Israel. During my studies, one of the people that were my supervisor was a psychiatrist whose name is Yossi Hadar. He happened to be on Yom Kippur War in 1973 in the battlefield in the Golan Heights. And he saw a lot of soldiers suffering from post-trauma. And this was very, with a big effect on him. And during the years, he decided to start an NGO in Israel, and it took him more than 40 years to do it, because only in 1997, Dr. Yossi Hadar called me and asked me to join him in establishing an NGO which will deal with the traumas of Israelis that suffer from the situation that we live in, of having so many wars, so many terrorist attacks. And it took me 24 hours to tell him that I will be happy to join him and do my best to do what we will find the right thing to do. So I'm really jumping on a lot of small details, but I want to get to the point that unfortunately, the week we opened in June 1998, Dr. Yossi Hadar was found to have leukemia. And 2 weeks later, unfortunately, he passed away. So I was left with a very small team of first professionals that joined us. And without the leader of the idea of the organization, of the opening of a trauma center. And for me, it was a very challenging time, because I had no experience at all in leading such a thing, or being involved in fundraising and things like that, that would enable to do what we do. But I don't know from where my colleague, Pastor Harris, would say it was like a vision. And it was really like a vision. I felt I had no chance. I knew I have to do it. I knew that it's stronger than myself and that I will continue and I will succeed. And you must understand that I came from a place of being a therapist who worked in a small clinic at home. And I did not have any experience in talking in front of people, in asking for money from organization and foundation and so on. And I found myself being led by my inner strength, which I didn't recognize before. So in 1998, until 2000, we were busy organizing NATAL and really doing our best to bring the right people to develop the vision and the plan how we will act. And we were completely ready when the second Intifada started in September 2000. It is hard to believe that 22 years passed since then, but we were completely ready with the tools, with the vision, with the plan, with the right professionals. And for all this period, I must say that it was a very challenging time. We had so many events and wars during these 23 years. I'm not exaggerating saying that we had 5 wars, including this war now, that we are just on the 10th day of this last war. And we had endless terrorist attacks. And NATAL is here to work, to give help through the helpline, through the clinicians that are working all over the country. We have more than 150 clinicians. We have a school for studying post-trauma psychotherapy. We have a community outreach team that works out of Tel Aviv in the peripheries, working with young, with adults, with communities. And we have clinicians working in Tel Aviv and seeing people. So many changes have happened during this period. It's really countless. But what I see, the organization is able to adapt itself every time to the changing times. If it was a time of war, if it was a time that we had a very big fire in the Carmel, we had some very big national events that we had to be there for the people who needed us. And when we had the COVID for 1 year, we did a big change in the organization to accept COVID patients, to call NATAL and get the support they needed. And as Mr. Firestone just said, we didn't have the time to celebrate our coming out of the COVID-19, and we a few days later started with this security situation in Israel of being attacked by missiles from Gaza, and if you heard the news today, also bombs from Lebanon. And what is going on in Israel is really creating a lot of stress, a lot of not knowing how to overcome, because so many things are changing so fast in this country that we have to adapt ourselves from moment to another to new events that we are involved in. And I can tell you that me as the founder, as a very active, I'm the chairperson of NATAL, and I see myself and as one of the workers at NATAL. I'm very much involved. I appreciate very, very much the wonderful work of our teams in Israel and our team in America and our board in America. And we are really doing, all of us, we feel so much and so strong identification with people of Israel. And when I say people of Israel, I mean all citizens in Israel. We work with anyone, the very religious, the secular, children, adults, Bedouin, Arabs, everyone who is in Israel, can get help, because all of us suffer and all of us need this help.
Well, Jude, all I can say is that if there was ever a week where your vision and your efforts over these years to really champion this issue, both professionally as well as organizationally, if there ever was a week where you all were and your colleagues, subject to, first of all, just getting a toda rabah, just getting thank you for that vision long ago. This is part of, in America, we're having a big debate about infrastructure now. In Israel, dealing with trauma is part of the infrastructure because it's part of Israeli life and reality. And so we're grateful for all those efforts. Ophir and Kim, you're the tag team between Israel and the United States, which we always love to see. What happens when you bring together 1 + 1, it equals 3. So we're going to turn over to you to learn a little bit about your methodologies and your approach. Obviously, it's not only about the current crisis, you're dealing with many different things. So let me give you the opportunity to share that, and then we'll continue the conversation with the other panelists.
Thank you so much. So my name is Ophir, and I'm the head of NATAL Global. I have the privilege of proving you that Jude's dream and vision has become a very successful reality organizational-wise. And I would say that if you ask me to say what is NATAL's impact, I can say from my own personal story that 20 years ago I was in the Army, I was in the Navy. And during our service and after our service, no one has talking about the transparent wound that me and my friends have suffered throughout the Second Intifada. And 20, for NATAL's 23 years later, there's still a long way to go, but there is a vibrant ecosystem that NATAL has created here in Israel in order to normalize the discussion about mental health throughout various of means, from brochures until campaigns, both in the social media and in the other types of medias, understanding that we are here for the people of Israel, both in one-on-one and also in anonymous means. So how do our services look like? As Jude mentioned, we do have a helpline, which is the gateway to our services. From there, people can call anonymously and receive short or long-term anonymous in the phone, intervention in the phone. From there, we have a clinical care that serves nowadays over 700 people. We do have community outreach and resiliency that have emergency intervention and resiliency programs in schools, in companies, and in other organizations. We do have employment and career development, trying to ensure that mainly veterans with PTSD can find their way into the open labor market and maximize their employment chances. We do have a trauma study center, and of course, as mentioned, we have a very vibrant awareness and PR department. looking on our helpline in 2020, as Jude's mentioned, we were asked and we were felt obliged to give services also to people who suffered PTSD from national crises such as the COVID, which have significantly affected our services and also increased in our calls by 80%. This is our work in 2021. And I show it now because it sees how much of attention we need to bring to the people. We can see here in this chart our incoming calls in total in green, and also NATAL's traditional helpline in yellow, and we can see the COVID helpline in orange. And you can see that in the third week of 2021, that's where we had a national lockdown. You can see a lot of COVID call. In week 16, you can see a big jump because it was Israel's Memorial Day with some very sad things that happens around it. And week 20, this is last week, this week, and we can see the significant amount in calls because of the current situation. And because this is only our gateway to the services, we anticipate a lot of growth and the needs to take care of people, both in our clinical care departments and other means in the near future. So we are getting ready for that, both with resources, financial resources that we need to find for that, and also human resources that we need to find for that, as Jude did. Our clinical units also have had a lot of growth. But we can see the increase. We can see the numbers of the treatment hours and the numbers of veterans that we have. I want to say that coming to the point of our programming, both in Israel and internationally, we do use the NATAL emergency routine cycle to plan almost everything we do. You mentioned infrastructure, Wayne. So we know that everyday resiliency building is the most important infrastructure because we have come to realize that what doesn't work in routine will never work in crisis and vice versa. Therefore, we plan a lot of investing in focusing on what is successful during routine. From there, allowing emergency intervention, both in the work of NATAL and in the programming that we offer other organizations, facilitating return to daily life, trying to ensure that this return is going to be healthy, is going to be quick, is going to be meaningful, and allowing post-traumatic growth, something that we work with a lot right now, both in Israel and in the US, basically around the COVID-19 crisis, asking ourselves, what can we learn out of this crisis in our own selves, but also in our communities and organizations. And this cycle creates preparedness of schools, preparedness of municipalities, preparedness of organizations, preparedness of agencies. I would soon move to Kim, but I just want to say that between 10 to 12 years ago, NATAL was asked by people in Israel and people outside of Israel, like Pastor Harris, to make our knowledge and tools accessible to more people, and not only veterans and civilians who suffer terror attacks, because stress is stress, and trauma is trauma. And what we have learned in NATAL makes sense to other, what we call foundations of societies. So so we have developed programming for decision makers, police officers, educators, caregivers, firefighters, faith leaders, of course, medical teams. And we help them to understand two things. First of all, how to recognize PTSD, crisis stress in their service users, but more importantly, how to take care of their own stress, how to take care of their own resiliency, how to ensure they don't have compassion fatigue or secondary trauma. So these very important people for our societies, both in times of routine and more so in times of crisis, can serve us, the communities, so we can basically maintain normal routine as possible, even during crisis. And now I'll hand it over to my colleague Kim from Colorado.
Thanks, Ophir. And yeah, my name is Kim O'Mara, and I wear a couple of hats at NATAL, kind of working with our American Friends of NATAL on the philanthropic efforts there to support NATAL's efforts in Israel, and also working with our global resiliency team on this collaborative efforts, which I'm going to speak about, and our work outside of Israel. So yeah, starting with what Ophir shared, I think that it's really important to recognize that what NATAL realized many years ago is that while it may look a bit different depending on where you sit, that stress is stress and trauma is trauma. And this resonance was really where our global work began. And as our wonderful founder Jude shared so eloquently at the beginning, that, you know, stemming from her leadership, that NATAL has this feeling that with this knowledge that we have and the work that we've developed, that it's really our responsibility to share that. So so that's really what began as an organic extension, I'd say, of our work at American Friends of NATAL, both raising awareness and making partnerships, has grown over the last decade as NATAL has been called upon by many sectors of society. And as Ophir shared that slide, be it police, hospitals, veterans organizations, community service organizations, really decision makers and community influencers at every level. And we were called upon to use NATAL's accumulated knowledge to help develop programming, to help empower more resilient societies, not just in Israel, but across the globe. And quickly, I'm just going to talk about a couple of the flagship offerings, I'd say, that we've developed here in the US. The first is what we call Spreading Resiliency in a Stressful World. And this is aimed at teachers, first responders, social workers, those in service and in care of others. And the goal here is to help provide them with tools for managing their own stress, going off the notion, as Ophir mentioned, that if you can't help yourself, you can't be in service of others. Or the classic airplane example comes to mind as I was just traveling with my toddler, that you have to put on your own mask before helping put on someone else's. And specifically, I want to focus a bit about our work with first responders here in the US, which began as an extension, again, of our work with first responders in Israel, specifically the training of 17,000 Israeli National Police. And from that training, we developed what's now titled Operational Stress Management Training. And for now, the almost past 4 years, NATAL has successfully developed a training for first responders in New Jersey that's actually through a partnership with the Department of Homeland Security. And this training really looks to empower first responders and help them to prevent both personal and professional burnout, provide them coping mechanisms, decision-making tools to use in everyday situations. And as Ophir mentioned that you know, the routine to crisis cycle, that it's really important that this training is embedded in the operational cycle of the units. First and foremost, as we say, to democratize the talk of mental health within these communities where it's often not. And second, it's to ensure that what's taught in times of routine can be implemented in times of crisis. Like we saw this year with so many first responders were faced with extreme hardships from the pandemic. So I'll stop here quickly and share a very quick video that was made about our program in New Jersey that I think gives a little taste of that work. So Ophir, if you want to pull that up.
In healthcare, in EMS, in police, we get burnt out very quickly because of all of the crises and traumas that we see.
We work in an urban environment, we see horrible things, and so individuals have to balance their personal challenges with their work challenges. So how can I tell others to do that without practicing it myself?
These are amazing men and women that give themselves every day to the community. Sometimes we forget that they're actually human and we need to support them too.
This is something that really should be talked about, and people should be relying on their peers for mental support, stress reduction, and overall just job satisfaction.
Because you can't take care of the others if you're not taking care of yourself.
They learn how to manage their own personal stress and professional stress. And we know from our experience working in Israel and in other places around the world that it actually reduces burnout, reduces suicide rates.
It's a fun way of learning stuff. We're moving all the time. We're doing physical exercises. We're laughing.
You're interacting with everybody in the group who's taking the training with you, and you're interacting with the instructors in a really unique, innovative way.
Becoming one as a group and getting to learn from each other's challenges and life experiences has brought this whole ability to understand the program to a totally different level. Everyone reacts differently to the challenges of the job, and this program has just been absolutely amazing.
And interestingly, that clip that you just saw, that was all filmed just a second before COVID began, and you saw that our instructors were on site from Israel. And what's really unique about this program and all of NATAL's offerings and trainings here in the US and globally is the train the trainer model that we often employ, which is designed to really empower local ambassadors and communities to help carry on the program themselves. So it helps to ensure both sustainability and scalability in each arena. So NATAL goes and gives the knowledge so that they can go and spread it further on their own. So the second thing I'll touch on real quickly, our other offering here in the US is our work helping organizations build capacities and working side by side with local community leaders and organizations to help build more trauma-informed services for their communities. And a few prime examples of this work is our ongoing work in Milwaukee with an organization called SWIM, which is an acronym for Scaling Wellness in Milwaukee. And it's spearheaded through a partnership with the Israeli consulate in the Midwest and anchored in Milwaukee actually through Marquette University. And what started there with a needs assessment on ground, again, right before COVID, has evolved into a multi-year partnership in which NATAL is helping SWIM to develop its own training modules and capacities to serve both civic and professional leaders in that community, including the building of their own hub or center, largely modeled off of what Pastor Harris will speak about. And also just want to make mention of our work with educators in Washington, D.C. through a partnership with the Israeli Embassy, and also multiple trainings for Jewish communities across the U.S., Brazil, and even Turkey through our partnership with the Jewish Agency. And that leads me to a transition of our shining example of this work is our collaborative efforts with Pastor Chris Harris in Chicago. And we're extremely grateful that Pastor Harris is here today to speak on that and his amazing movement in Chicago. So I'll turn it over to him now to share more about that.
Thank you so much, Kim. And so to all of you all, to all of my friends that are here, certainly to Jude and Wayne, thanks for having me today. It is really, really a privilege to share with you all. Again, I'm Pastor Chris Harris of Bright Star Church Chicago in the Bronzeville community. And the exciting thing is what you don't know about Bronzeville, it is the place where jazz, gospel, blues, all of those wonderful things come from. It's known as the Black Metropolis. It's where the Great Migration was, when people of African Americans across the country, they were trying to leave from the terrible racism, systemic racism then that we still experience now far in the South. They were leaving Mississippi and Georgia and Alabama, and they came to Chicago. And they came to a place called Bronzeville. They could not go to the west because they were so racist over in what is called Bridgeport. And they couldn't go to the east because of classism and racism over in the Hyde Park area. So Bronzeville, Greater Bronzeville, is what we call 67 South, 22nd North, Lakeshore Drive, Dan Ryan, the place where Emmett Till's funeral was held, and so many other things. And so I encourage all of you all, if you're ever in Chicago, you gotta stop by Bronzeville, the Black Metropolis. I'm a son of the soil of Bronzeville, born and raised here, and I get to pastor the church that I was born and raised in, Bright Star Church Chicago. Check out our website, brightstarchurchchicago.com, and now founder and CEO of Bright Star Community Outreach. Check out that website as well. But I got connected to the Jewish community through APAC's African American Outreach, and who knew that from that relationship, I would end up going to Israel in December of 2012, saw NATAL, built relationship both with NATAL and the Jewish community, and so much has happened since then. I can tell you a whole lot of things that have happened, but it is so much better for you to be able to see that there is a real partnership. Check this out for a moment.
I am from Chicago's South Side. A music lover, a recording artist, I am a teacher, a pastor, and a community leader. I am, you are, we are.
December of 2012, I saw a place called NATAL in Tel Aviv. And what blew me away was the fact that they had people in Israel that suffer from PTSD. But while they worry about missiles and sirens there, we're counting body bags and toe tags every single day in Chicago. So I decided I wanted to bring back to Bronzeville what I saw in Israel. One of the things that prompted this work is the fact that there's this vicious cycle of violence. And folks were asking, why does this happen? That's why we have to do the trauma counseling work.
So, we know that hurt people, and so we end up as advocates, we end up as wounded healers.
The reality of it is, to ask for help is actually showing strength. It takes a strong person to ask for help, to need, to show that they need help.
I shared with you, I'm a son of the soil of Bronzeville, raised up in the Dearborn homes, 2930 South Dearborn. So I work, worship, and witness in the place that I was born and raised. And that's really exciting. So when you think about Bright Star Community Outreach's turn model, it's 5 core competencies: counseling, mentorship, parenting, workforce development, and advocacy.
This is what gets me happy. It is also evidence of the growing ties between the Jewish and African American community. Oh, I need a few more amens right there. Like in the days of Dr. King and Rabbi Joshua Heschel, that all of us, whether it be violence at this synagogue or violence on the south side of Chicago, we should say nothing about violence until we do something about violence. They're ready back there. Now you gotta clap your hands real good. Put your hands together. Walk with me. Walk with me. Walk with me. Clap your hands. Walk with me. Come on and walk with me. Walk with me. Jews and blacks. Walk with me. White men, black people. Walk with me. Come on and walk with me. Walk with me. I said walk with me. Put your hands together.
So for me, anyone can say that they're partnering, but that has to go far beyond just words. African American and Jewish people, whenever I'm traveling the country, doing work with, whether it's APAC, the ADL, JUF, JNF, whatever, KUFI, whatever the organizations are on college campuses, I call it the Jewish alphabet soup with my friends. And whether I'm on college campuses, teaching young men from Alpha Epsilon Pi or young women from Sigma Alpha Epsilon Pi how to combat BDS, how to build bridges between African American and Jewish community members, or traveling the world singing the Hatikva. Yes, I can sing the Hatikva. Most of the people always say, oh, Pastor Harris, they pull up these beautiful photos of Dr. King and Rabbi Abraham Joshua Heschel, of Blacks and Jews working together. And I always tell them, sorry, I know I'm a preacher, but that's BS. You want to impress me? Those are old photos, and stop trying to take credit for what African American and Jewish people did way back then, decades ago, like Dr. King and Rabbi Heschel. And what about people like Booker T. Washington, along with individuals in the Jewish community? It's been like Rosenwald, Julius Rosenwald. You want to impress me? Let's keep the old frames and let's put new pictures in those old frames of us working together now. That's why I love the work that we've been able to do with NATAL. And we developed from that relationship the Urban Resilience Network. Now listen to me good. Finding what Jude founded was amazing for me. Because again, how did we urbanize it? No, we didn't need white people to helicopter in and save Black communities. No, give us the training, the tools, and the resources. We're resilient people as African Americans. We know how to save ourselves. But here's what NATAL understood. It needed to be owned by us, driven by us, and led by us, but not just us. And that's why we built the bridge and came together as communities to say, let's go beyond words, because anybody during Dr. King's birthday, as what Jews and African Americans do, come together and sing, "We Shall Overcome." But we really are not serious until we come over into each other's community and make sure that we come over together. That friendship has developed into kinship. And now this partnership has allowed more than 45,000 people in our communities to be able to benefit from trauma counseling through the helpline, through our ambassadors. And this work is important. So what I encourage everybody to do, get to the place where we understand we need to be friends before we need the friendship, like times like right now. And we need to make sure that we go beyond words and actually do the work. And I'm really proud to be able to do that work with my friends at NATAL. So I'm excited about this conversation. And I'm more excited about all the work we have to do in the coming future. Thanks, Wayne.
Hey, Chris, I could just say amen here because you have so many Jewish friends and have become a model for what, as you said, not the history of Black-Jewish relations, but the future of Black-Jewish relations.
Yeah.
We're two communities in tremendous pain right now, and friends have to be there when you're experiencing pain and as you said, need to be honest about what that is. And the truth is, we bring different things to the table about what then we can do with it. And I don't want to emphasize the importance of your being with us, singing with us, praying with us at a moment that we're feeling such isolation, whether it was because of COVID earlier in the year or because many of Israelis are in harm's way each day during this crisis as we continue. And I want to accept that challenge that you're throwing out there, because you give a lot of thought to the words and the prayers that you're sending, and even the short film. You spent more time putting together that film, and that is like Mark Twain's short letter. So we appreciate the thought and the intention with that, and we really are very much looking forward to building a relationship that requires us to bring our different talents and experiences to this relationship, and at the same time acknowledge each other's hardships and pain, because that's part of the message. And we need music for that, we need friends for that, and we need a vision to move forward with that. And certainly you've built something in Chicago that really is, and I think when we get back, I'd love for people to hear more about what it actually, the training you've done with NATAL, how that's impacted on your community. I want to get one more perspective in before we go there, from Tony Young, a board member who has seen this on both sides of the ocean, but really has a perspective on the importance of how we can take the learnings and the experiences of the Israelis in a certain context and begin to cross-fertilize that and share that in other settings, certainly in the United States, but increasingly we see this as a global phenomenon. And so, Tony, perhaps you could speak to that moment in NATAL's organizational development where you're able to do that now so well.
Thank you very much, Wayne, and I'm delighted to be part of this group. You all have spoken just beautifully, and I'm proud to be one of you. I'm going to shorten my remarks because I know we want time for discussion. I've been involved with NATAL for about 14 years now. The reason is simple. I recognized right away that NATAL was improving lives for all Israelis, and that it had the potential to teach what it knew and help people, millions of people, all through the world. And we've heard evidence of that today from Pastor Harris and from our other example. People want to know how I got involved in the first place, if I'm here in North America. And I would take you back to 2007, and there are two primary reasons. The first is the outstanding, remarkable Jude Recanati, who will get angry at me later for saying this, but she is, you heard her. I don't have to say anything else. Jude recognized a need. Jude was early in this curve. I know to some of the younger people on this call, it may sound incredible, But we used to focus, I'm old enough to remember the Yom Kippur War and even the 6-Day War a little bit. We used to focus on all the horrendous, important physical things that happened to people. They were terrible, they needed help, but we were not so aware of trauma. We were not so aware of the psychological effect that was happening. Jude described her coming to this realization as if it was inevitable. It wasn't, it's her. And I think you heard from the power of the words that she spoke before. People make things happen. Jude has made this happen. At the same time that I was fortunate enough to meet her and become a friend, I was chairing for the Federation System. The Jewish Federation System at the time was called UJC, United Jewish Communities, and I was chair of the Israel Overseas Pillar, which meant that I was part of a committee that oversaw how hundreds of millions of dollars that were raised were distributed in Israel. And at that point, NATAL was one of many organizations in the Israel Trauma Coalition. And it was the first time I remember that people were talking about post-trauma stress disorder. It sounds funny now because it's so much with us. But I became convinced that this is important, not just because every human life matters, but because if we want strong societies and strong countries, we have to be mentally stable. We can't have a bunch of people who are working out their issues in public society. It's a major thing that we all should be paying attention to. Some of the a few members of NATAL, people who have received help from NATAL, have spoken out in order to influence other people. And among the things I learned from them is one, how accessible NATAL is. You hear an ad on the radio, you call up, and a real person talks to you without asking you for all kind of policy numbers and your whole life history. They hear what's bothering you right now. It's the immediacy of it. It's the privacy of it. No one at NATAL would ever share anything unless the person themselves wanted to do that. And it's the ability, as was said earlier in the program, to reach out into any new field. The fact that NATAL, in the middle of a crisis, was able to focus on COVID, how wonderful that they have the tools, that they know the big need. So I'm having a couple of weeks, like most of you, where I feel completely helpless. I'm sitting here in the United States worried about whether it's going to rain tomorrow. And look what's going on in the world. And what I suggest to you is that whatever it is that you can do to help NATAL, whatever small amount, you will make a difference in somebody's life. You will help somebody. And maybe in some ways that can help ease the pain that we're all feeling and bring us all together as a family. So I will stop now, and please, let's hear the questions.
Tony, thanks so much for the point. So I want to quickly get in a couple of questions that have come in. One interesting one that I think the whole world has sort of been looking at Israel in the last few months in the context of COVID about, frankly, the success of the vaccination program. And we've explored on other programs why that is and different aspects of how the healthcare system works in Israel, but that's different, certainly, than the United States and other places. But to what extent has the healthcare, we have a question from actually Canada, from one of the viewers today, about how trauma and care is addressed, if at all, through the healthcare system in Israel. So Jude, I wonder if you could maybe just comment on how much of your work is complementary with the healthcare system, how much of it is sort of standalone.
So it is how do you say? It's a process. The beginning was not at all working together with hospitals or health institutions. But the last 10 years, NATAL is very much involved in training medical teams in hospitals, nurses, and other professionals. First of all, to deal with their own traumas, and then to give them the tools to work with their patients, to work with people that are hospitalized. We are collaborating with any organization in Israel that is in a need to learn or to change the attitude in not only medical but also educational organizations and just organizations that need the help of teaching their workers how to acquire resiliency in situation of stress, in situations such as the COVID or a disease in the family or somebody who passed away. The tools are good for many problems that we face in our lives. With the Ministry of Defense in Israel, which is taking care of all the wounded soldiers and the families of the bereaved families, we are also working, and hopefully I think that the relation will become more close and the work will be done more together in the future.
That's really helpful. Chris, I want to make sure, you have seen NATAL operate in a very different context now in your own community in Chicago with dealing with gun violence. Over the summer when we last spoke, during a period of tremendous, really just trauma for all Black Americans in this country. You're watching your friends in Israel now go through sleepless nights, not just because they're worried, but because air sirens are going off. What are the common themes that you see from those different perspectives that you've encountered, this phenomenon?
So it's pretty interesting you would ask that. I think a lack of security, a lack of safety, a lack of confidence that the conflict will ever end. When you're asking me about those similarities, it is the daily trauma, and I will make a contrast as well. What I did notice is in Israel, I've been there 6 times now, I have led many leaders to trips over there, and I look forward to going back. I mean, heck, I've gone so many times, folks think I'm going to make Aliyah, but the reality is, when I'm in Israel, they have 15 seconds to get to a bomb shelter. We have no sirens on the south side of Chicago and in urban communities. If there's a drive-by shooting, there is no warning. There is no siren. There is no 15 seconds. There is no bomb or bullet shelter. So that's a very different thing. And the other side of it is knowing who that enemy is a lot of times is very different in Chicago. And so there are tremendous amounts of trauma, uncertainty, daily unrest, and it is very, very challenging. And so while there are many similarities, there are also a tremendous amount of differences. For example, yet another one, when I came from Israel and I decided to bring the NATAL model back, one of the things I shared with our mayor is we don't have an Iron Dome here in Chicago. There is no missile defense system, right? And so there needs to be tremendous investment in those urban communities to save lives in the same exact way. There is tremendous investment from the U.S. to Israel to say, hey, we want to keep you all protected. But what I have found is there's so many people who care enough to say, hey, Pastor Chris, I'm going to get involved. So that's what would be the initial way. And a lack of certainty on funding. That's a huge issue, but a whole nother conversation.
Sure. Ophir, I'm going to give you the last word today. Jude used the term adaptability, and certainly your organization, that has to be in your daily operational mode. How have you adapted immediately for the crisis that you're currently dealing with, on a day-to-day basis?
Well, we have, I guess, 4 crises at the same time, right? I must say that the first crisis happened last March or last April, when the COVID started, and we were stuck in the middle of major projects, with our trainers saying, listen, NATAL's training and work is very experiential. It's very, we are proud to be not death by PowerPoint. We touch the people. How can we take this forward? And we immediately did 2 things. First of all, we initiated 3 roundtables with very significant international actors from the US and Canada and Australia and Europe. I cannot tell you the names, but very, very significant agencies to discuss the issues and to interact. And secondly, we adapt quite good for the online, offering podcasts, offering webinars, and also accepted, of course, the pastor's call and request to make an online training for a new cohort of their staff. In Israel, I want to say that NATAL's work in a way that it can expand and goes back to routine as fast as possible. So today, all of us are helping our helpline and our clinical work to expand as we need to take care of these immediate needs here. And I want to say this also what we learn and what we teach and what we scale, the ability to adapt as quick as possible to this emergency situation and come back to routine as fast as possible and as healthy as possible.
Well, thank you, Ophir. Thank you, Natal, for your work. Please be safe, and we know this is a stressful period for everyone in your organization, being on the front lines, really front first responders to the trauma, and that deserves a calling out as well. 2 quick program notes. For those of you with us all year, we do this every Wednesday, every Sunday. You can set your clock around us. Tomorrow, we will be having a special briefing on the security situation from the Israel Defense Forces. It will be on Thursday. That's tomorrow for anyone watching later at our normal time of noon. So please plan to join us for that as well. Invitations will go out after this call. And secondly, our way of dealing with trauma during COVID, during the multiple crises, has been to continue what we're doing. To continue to connect Israelis and Americans. And on Sunday, our next webinar series is a virtual tour visit of Tzipori. So if you needed some place to go in your mind to put on your back, think about having a new screen, your new backdrop could be those incredible mosaics at Tzipori. Come with us on Sunday. We're going to have a virtual tour together. It'll be our way to de-stress a little bit together. Thanks, everyone, for being with us. Have a safe week.
Thank you very much.
Thanks for having me.
Thank you.
Thank you.
Take care.